The death toll from the devastating earthquake that hit Myanmar on March 28th has now surpassed 3,600. UNICEF emergency specialist Louise Gorton shares the current situation on the ground more than a week after the 7.7 magnitude tremor first struck.
This earthquake has been devastating for the people of Myanmar. UNICEF now has teams on the front lines in the worst affected areas in Sagaing, in Naypyidaw and Mandalay. And what we're hearing back from them is that the situation is really catastrophic, especially for children. Entire communities have been flattened. There's huge damage to homes and critical infrastructure. Most of the affected areas still don't have electricity supplies or telecommunications. We've seen schools and hospitals that either destroyed or completely unusable. And because of water supplies have been disrupted, water is beginning to run out in some areas. Our teams in the field are reporting they see children and their families sleeping in the open, exposed to the heat and rain with no access to clean water, food, or basic medical care. And children have lost parents and caregivers. So some are searching for them, and parents desperately looking for their missing children. And as you can imagine, the psychological trauma there is immense, particularly in the light of these ongoing aftershocks that we're experiencing in many of the affected areas.
Prior to the quake, Myanmar was already facing civil conflict, public health emergencies, and climate-related disasters. Louise discusses how this latest disaster has compounded existing challenges for children and their families.
What we see in Myanmar now is nearly half of the children are living in poverty. More than 1 million children are unvaccinated, and a third of school-aged children were out of school even before the earthquake. So the earthquake has only deepened and compounded these issues, putting more children at risk, and it's really increased the need for urgent life-saving support. A particular concern now is the potential for disease outbreaks. Many of the earthquake-affected areas were impacted by a cholera and acute watery diarrhea outbreak since June last year. And so now that we have water supplies cut, lack of sanitation, people living in the open, and the health facilities overwhelmed, this could really be catastrophic if cases begin to increase. Beyond the physical harm, children in emergencies also face increased psychological distress and trauma, and unfortunately, they can be exposed to exploitation and abuse.
Based on reports from the field, earthquake victims in Myanmar are in urgent need of food, water, safe shelter, and medical care. Louise highlights the challenges in delivering aid and support to those affected.
The earthquake has damaged vital infrastructure, including telecommunications towers, airports, roads, and bridges. And so that is slowing down relief efforts, as it means that we may need to take longer or alternative routes to reach affected populations, or use smaller vehicles so that we can safely transport supplies over bridges that might be damaged, that kind of thing. But we are pushing through. The lack of funding is another significant challenge. Myanmar was in the midst of an ongoing complex and chronic humanitarian crisis, and it was one of the most underfunded crises globally. So UNICEF is now urgently appealing for $28 million to kickstart the initial response. And this immediate funding will help us provide life-saving support, including clean water, sanitation, medical supplies, temporary shelter, psychosocial support, and emergency education.